Hi, my name is Ibiwa Abdullah and I'm from Spring, Texas. Hi, Dr. K. When I'm in traffic and I see an ambulance with their lights on driving behind me, what should I do?
Well, the holidays are coming up upon us and you're going to be interacting with this vehicle a whole lot more. We're going to get a lot more calls. There's going to be a lot more traffic. So let's talk a little bit about this 8-ton vehicle and what the rules are, what you need to do when you see an ambulance, what you're allowed to do, what we request you do, and just how all that operations work. So come on for a ride a little bit and we'll talk about exactly what the rules are and what we need to do with this truck.
All right, we got help on the way. I'm 8305.
So when we receive a call in dispatch, we ask certain questions that determine whether we need to respond to you with lights and sirens. If we're responding emergency traffic, lights and sirens, there are a set of rules and regulations that we must follow. We're going to talk a little bit about that and then how that impacts you and what your rules and regulations are. So when we're responding emergency traffic, we may need to drive on the shoulder. We may need to go against traffic flow. We may need to go through red lights. We are required to stop, check, and then proceed. These are safety rules and regulations. Our vehicles are equipped with special transponders that can actually control some of the lights. So again, we have the ability to change some of the traffic flow. So this vehicle is for the safe response, treatment, and transport of patients. When we're on scene, it's very important that our crews make an evaluation, make an assessment, and stabilize the patient. It's about time to critical care provision for that patient. It's about getting them stabilized. You may see the ambulance sit on scene. We may have to do a lot of medical procedures in the back. It's best done when the ambulance is stationary, when we have extra hands, we have extra equipment and help, and we're not jostling around, going around the road. We're going to bring the care to you. We have a lot of critical care, we have a lot of skills, we have a lot of medication, we have a lot of interventions that are life-saving. We're going to bring that directly to you. Occasionally, we're going to get that patient in the back of the ambulance, and we have more stabilization to do. What's important if you see an ambulance stop is to make sure that their egress, that you don't block our leaving, because we're not sure exactly how long we're going to need to be there and when we're going to need to head out. So after we make the scene and we initiate care, we're going to determine whether that transport to the hospital needs to be emergent or not. Do we need lights and sirens to get from the scene to the hospital? Can we provide that necessary care quickly on the scene? If so, we're not going to transport lights and sirens. Transporting the patient from the scene to the hospital, you're going to have one medic driving and one medic in the back taking care of the patient. Again, that's why we stay on scene. That's why we try to get stabilization done, because it's often difficult and dangerous to provide care in the back. Remember, if you are following an ambulance, that you need to stay back at least 500 feet. That's about 3 seconds stopping time, or about 6 seconds if the weather conditions are wet or icy. You have to remember, this is an 8-ton vehicle. That's probably about 3 to 4 times the average weight of a car. It's got a wide turning radius, and again, we may need to make quick movements, etc., in traffic, so you need to keep the distance from the vehicle. So if we're transporting a patient, perhaps your loved one, you have to realize that the emergency traffic laws do not apply to you. If we have to go against traffic, if we have to make certain turns, if we have to go through red lights or stop signs, etc., you are not allowed to do that. So if you're driving your vehicle and you hear the siren, if you see the lights, if you see an emergency vehicle approaching you or in your rearview mirror, what should you do? First thing is to slow down. Second is to determine whether you need to turn left or right. Use your blinker depending on which direction the ambulance is coming. They may be coming on the shoulder, they may be coming in the passing lane. If the ambulance is coming on the shoulder, again, you may need to move left. If the ambulance is in the passing lane, you may need to move right. You need to move slowly, you need to use your turn signal, and you need to warn the other people on the road exactly what your intentions are. It's best to stop, because the ambulance doesn't know what you're going to do, even if you're moving. Doesn't know if you're going to turn left or right or stop. The best way, the safest way for everybody involved is to move to the side, safely, slowly, using your turn signals, and stop. Rarely there may be a situation where The medic in the back needs extra set of hands or extra help. If the patient becomes very, very critical, this ambulance may need to pull to the side of the road and pull the second medic into the back to help. If you see the vehicle stopped on the side of the road, you must follow the same rules you would as a police car, a tow truck, a fire truck, etc. You need to move as far left safely as possible and reduce your speed below the speed limit. So what should you do after the ambulance passes you, after you've allowed the safe egress? You need to resume driving. You need to be aware of the other drivers who have stopped and pulled over because they're going to resume traffic as well. You also need to be aware that there may be more emergency vehicles on the way. You need to look to make sure there's not another ambulance, a police car, fire truck that's also going to be passing your direction. So if you've got a question you'd like us to answer, just say, "Hey, Dr. K," and we'll respond to you. I'm Dr. J. Kovar from the Harris County ESD 11 EMS.